For candidates preparing for their clinical assessments, I would suggest they obviously prepare as well as they can and get as much practice that they can in different settings if possible. I appreciate that that can be difficult, but trying to have practice with different patient groups, with different problems, different issues, different ages, different genders, as broad a preparation as possible.
The advice that I'd give to candidates who are preparing for the assessments is to not prepare too much of a script, not to sort of come in thinking that you can only do things the one way or very specific scenarios, because with the nerves of the day, and we understand that people get really nervous, if you expect things to be a certain way and then they're not, it can really mean that the wheels fall off and people get really anxious and get a bit lost. I think it's also quite transparent when you are one of the assessors if somebody is doing that, and it doesn't allow you to show your physiotherapy skills and your thinking on the spot, which is what we do in practice. So not to be too scripted is certainly one thing. Another thing that I would say is that rather than, yes, practice some scenarios, but think instead about having a really sort of thorough and strong assessment skills in each of the three areas, cardiothoracics and neurological and musculoskeletal physiotherapy. Really make sure you have like a range of assessment skills and you feel really confident with your subjective and objective assessment, and then based on that what you would then do for some treatments. So just work on sort of more having a real toolkit, I guess, of assessments and treatments that you can draw on the day rather than being really specific.